What are you people doing? You just spread COVID-19 around to each other so much that you overwhelmed our local hospitals. You know, those ones that I said were not prepared for coronavirus? The nurses from those hospitals are now going on the news and saying, we don't have enough staff. We've got an issue with missing breaks. And the people who are supposed to be cleaning the rooms are either not showing up or being asked to clean rooms with COVID-19 patients in them, and then ostensibly going on to clean the rest of the hospital. So everything I said was right. And I'm sorry to tell you this, but you should have listened to me. You know what? I'm tired of these people not listening to me. If you don't want to listen to me, I'm going to play you a video clip of an expert who will explain to you why we should never have opened up California or opened up Humboldt County, and why saying, oh, all you need is the vaccine, and that is all you need, vaccines alone will stop this, is stupid. If you don't believe me, listen to an expert.
5-year-olds are now ending up in ICU in parts of America where the virus is high and jabs are low. But double-jabbed people are also going to hospital in countries with high vaccination. So what's ahead for us when we eventually open up? Dr. Eric Feigl-Ding is a Harvard epidemiologist who predicted in January last year that COVID-19 would be a thermonuclear pandemic. He meant bad, and he was right.
Last year, before almost anyone in the world thought that coronavirus, which they're now calling COVID-19, was going to be a pandemic, I recorded not one, but 2 videos called Humboldt County's Hospitals Are Not Prepared for Coronavirus. Do you remember these videos? It's likely that few other people in Humboldt County remember them either, because few people in Humboldt County actually saw them. If you want to know why, ask Ryan Sundberg and Scott Binder. Scott Binder is the one who banned me from Humboldt County on alert, calling me a conspiracy theorist for daring to say coronavirus was going to be worse than the flu. And Ryan Sundberg is the one who posted emojis of anime chicks with the text, I want attention, underneath, and told people not to watch my videos, they were only clickbait for money. Please stop playing a video while I'm recording a video. Now, perhaps if these 2 people had promoted my videos instead of calling me a crazy conspiracy theorist only trying to make money, perhaps somebody in Humboldt County, California would have listened to me. What are you people doing? You just spread COVID-19 around to each other so much that you overwhelmed our local hospitals. You know, those ones that I said were not prepared for coronavirus? The nurses from those hospitals are now going on the news and saying, we don't have enough staff. We've got an issue with missing breaks. And the people who are supposed to be cleaning the rooms are either not showing up or being asked to clean rooms with COVID-19 patients in them, and then ostensibly going on to clean the rest of the hospital. So everything I said was right. And I'm sorry to tell you this, but you should have listened to me. And the Humboldt County supervisors are assholes. Especially Rex Bone. You know, the one who's famous for asking Diego if it was stolen. That was a joke. He's actually famous for saying the Mexican food was so good that it made him want to go out and steal hubcaps. Which, by the way, got him in major trouble.
His name sounds like he sells so much crystal meth it makes me want to
have a T-Rex sized boner? Okay, good one. I think I might have just read his mind.
Hit him up for some tweet, but I'm just kidding.
Anyway, Rex Bone recently announced that he has COVID-19, but it's not that big of a deal because he's fully vaccinated. He is also one of the biggest sponsors of the Humboldt County Fair, which I'm pretty sure is still going on. So, you know what? I'm tired of these people not listening to me. If you don't want to listen to me, I'm going to play you a video clip of an expert who will explain to you why we should never have opened up California or opened up Humboldt County, and why saying, oh, all you need is the vaccine, and that is all you need, vaccines alone will stop this, is stupid. If you don't believe me, listen to an expert. Roll that clip.
We're told high vaccination is the only way back to normal. 5-year-olds are now ending up in ICU in parts of America where the virus is high and jabs are low. But double jabbed people are also going to hospital in countries with high vaccination. So what's ahead for us when we eventually open up? Dr. Eric Feigl-Ding is a Harvard epidemiologist who predicted in January last year that COVID-19 would be a thermonuclear pandemic. He meant bad, and he was right. Doctor, thank you for your time. Our two biggest cities in Australia are in lockdown right now, and Delta is well and truly out of the bag in Sydney. Can lockdowns work now to wrestle Delta under control, or will we have to vaccinate our way out of this situation?
Delta is definitely spiraling out of control worldwide. But the lesson is that even for highly vaccinated countries, relying on vaccines alone is not a panacea to stop Delta. Delta is twice as contagious. It's more contagious than smallpox. It's on the level of chickenpox in terms of contagiousness. And what that means is that just relying on the single vaccine approach is very, very narrow-minded. We must do other layers in addition to waiting around for vaccines.
We are not a highly vaccinated country. We have only double vaxxed something like 23% of our adults, anyone over 16. The New South Wales government is talking about easing restrictions in this current lockdown if we hit 50% of adults vaccinated by the end of this month. 50. What do you think of that plan?
We have seen the Delta variant surge in places even with 50% vaccinations, even with 60% vaccinations. And Iceland has over 75% fully vaccinated. And guess what? Iceland is still seeing a surge with the Delta variant. The Delta variant is so contagious that you have to layer on other things. So I think reopening without any other measures in place with 50% vaccinated, this is a very dangerous gamble to take. And I don't think we should risk it. Premium masks for all citizens in all places, avoiding indoor dining, which is always risky, and improving ventilation and air disinfection.
You've just talked about masks. I think, most Australians have a cloth mask in their pocket or in their handbag. Are you saying that that's just a waste of time, cloth masks?
Cloth masks are not a waste of time, but they are a partial protection. Masks only work with cloth masks when everyone wears it, because cloth masks are best for catching your aerosols and droplets, but it's not good for inhaling as a filter.
Our federal government has released a science-based roadmap, effectively, that's quite confusing and convoluted, but essentially it sees the way to reopening international borders once we hit 80% of, double vaccination in Australia. Is that realistic, or should we brace ourselves for what happens when we get there and we do that?
I think it's not whether it's 50% or 80%. In certain ways, I think 80% of the total population may not be enough anymore with Delta. There are many experts who say 90%. I know Australia has really great testing and contact tracing, but that's not enough. That's very reactionary. We need prevention methods in addition to vaccinations. The vaccines are good hospitalization prevention measures, but in terms of leakiness, they are very leaky for transmission.
Okay, so hang on, am I hearing you right? You're saying that even if we get to 90% of vaccination, which most people is saying is unrealistic, that no country will ever really get to 90%, we will still need to wear masks and we'll still need sort of restrictive almost semi-lockdown measures. Is that what you're saying to beat Delta?
I'm not saying that we need hard lockdowns. No one wants lockdowns, but without these other measures, you cannot just simply hope that if you reopen, but you don't have premium masks, you don't have ventilation standards, ban on indoor dining, I guarantee you will be headed towards a lockdown because the cases will be surging so quickly and the hospital beds will be filling up. Without these other measures, you're headed for disaster.
Because Australians are being told that once we get to 80% vaccination, we will start to be able to treat coronavirus like the flu.
I would like to end this video by saying a few things. First of all, I called all of our local hospitals at the start of the pandemic, said I was a reporter doing an investigation, and I wanted to know what they would do in the case of a COVID-19 surge. And I could not get anyone from any hospital administration to even talk to me. And the only people who did talk to me actually gave me sarcastic answers. That scared me. I talked about it in videos I made a year ago or more. Second, I actually considered looking up which COVID-19 vaccine was the safest and getting it on camera to see if it made me have a reaction. But I wasn't going to do this without making sure I was properly monitored by doctors in case I did have a reaction, because a few of my closest friends, including one with similar medical conditions to me, had reactions. So when I saw news stories about nurses getting the COVID vaccine, immediately fainting, but that was okay because they were in the hospital, the doctors knew about their conditions and were monitoring them, I called our local hospitals and the Humboldt County Health Department to see if they would do that for me, if I wanted the vaccine. And they said, no, they're not going to do anything at all whatsoever to monitor me after I get the vaccine. If I wanted, for example, a heart monitor to make sure it didn't cause me to have a heart reaction because I have a heart condition, I would have to go to my own cardiologist myself and arrange to have the heart monitor myself. The lady named Linda, who I was talking to, then told me there was no risk of the COVID-19 vaccine, which she called the COVID-19 vaccine, even though there are 3 approved in America, causing me to have a heart reaction. My doctor disagrees. Even my doctor suggested that I get this heart monitor thing if I wanted to get the vaccine. And by the way, she didn't mention anything about those women missing their periods or getting heavier than normal periods to me, even though that's happened to many women who've had the COVID-19 vaccine. And I was recently almost hospitalized for almost bleeding to death due to what may have been a miscarriage or a heavy period. The only reason I wasn't hospitalized is that the nurses at St. Joseph Hospital, the ones that are currently telling the media that their hospital is dirty and filthy and they're missing breaks and stuff like that, were so rude and nasty to me that I ran out in fear that they were going to kill me or severely abuse me rather than giving me the proper medical treatment. And I'm not stupid, and I'm not even anti-vaxxer. I'm just a person who's had the experience of taking one pill the doctor said was going to make me feel better that made me feel sick for 20 years. I'm the person who was told, we're going to put you unconscious and remove your wisdom teeth, who woke up with a 3rd-degree burn, blackened and charred right here, and never even found out how it happened or got a penny of compensation for it. And that leads me to my 3rd point. If you want somebody to take the COVID-19 vaccine, then it should be like any other pharmaceutical. If it gives you a bad reaction, you should be allowed to sue the company that made it. If I take aspirin and I break out in hives and get hospitalized needing epinephrine, I can sue the company that made the aspirin. If I get the COVID-19 vaccine and the same exact thing happens to me in the USA, I am legally not allowed to sue. A teenager in Singapore got the COVID-19 vaccine and had a heart attack. They gave him hundreds of thousands of dollars. Americans who got the COVID-19 vaccine and had bad reactions have gotten $0 from the US government. who supposedly has a program to compensate people who aren't allowed to sue, who are still going to need to be compensated somehow. So make sure that if we get the vaccine and get a bad reaction to it, we get medical care and also can sue. That is what will make people like me get the vaccine. And with that said, I'm going to end this video because I think that a lot of people in Humboldt County, California agree with me, like completely. Hopefully they'll see this video. Somebody please go and post this on a Facebook group called Humboldt County on Alert. Say, wow, why didn't you people listen to this girl? Or something like that. And just post it. Tag Scott Binder and Ryan Sundberg and Rex Bone too when you do so, please. And anyone who's sponsoring the Humboldt County Fair,